Hi, this is Science and Fingertips. I'm going to explain the symptoms of dengue and how dengue is treated. Ali was playing with his friends in the dark and hot before sunset when he got bitten by a mosquito. It's common to have a mosquito bite, but this one was carrying a virus. 4 days later, all developed high fever and complaints of pain in his eyes, severe headache, and body aches. His concerned mother immediately took him to the doctor and asked doctor, "Why is my son sick? Is dengue?" Dengue is a common problem in many parts of the world. This virus is more common in regions with warm and tropical climates. Prevention of dengue depends on avoiding mosquito bites that carry this virus and controlling their population. It is important for us to know what the symptoms of dengue, how it is treated, how we can protect ourselves. Let's ask Dr. Smart about it. Hello and welcome. I'm Doctor from Smart Clinic today. Let's talk about dengue fever. What is dengue fever? How it is spread and what are the symptoms? Dengue fever can become a serious illness. It is caused by a virus that spreads from a bite of an infected mosquito. It's important to know that dengue is not contagious and does not spread from one person to other person through contact. But if an infected person is bitten by a mosquito, then that mosquito can infect the next person. Symptoms of dengue usually appear 4 to 7 days after the mosquito bite. Symptoms of dengue may be mild or severe. The most common symptoms of dengue is high fever. You may also have pain in the eyes, headache, nausea or vomiting, rash, joint pain and body aches. These symptoms usually last for 1 week and then start going away. Many other infections can also have symptoms similar to these, like malaria, COVID, or other infections at time. People infected with dengue may not develop any symptoms at all and may not even know they got infected in such cases. Dengue can cause a serious problem. The blood can become thin with a high chance of bleeding, which happens when the number of platelets in the blood become very low. You may notice bleeding from the gums after brushing the teeth, bleeding from the nose or skin rashes with the small red spots. If you have bleeding in the gut, then you may got also have bloody vomiting, blood in the stool, and black colored stool. In some cases, a severe infection can result very low blood pressures. It can damage different organs and cause even death. Medical care and close monitoring is needed in such cases. Severe dengue is more commonly seen in infants, pregnant women, and those who have had a dengue infection before. Dr. A. Dengue fever does and treated many other diseases, and infections can have similar symptoms as dengue. Dengue should be suspected if you have a sudden onset of high fever as high as 1 or 2 to and not 5 Fahrenheit. If any of the symptoms that I had mentioned before, to check its dengue, we do a blood test for dengue antigens and antibody. We also check the levels of platelets. If the levels are very low, you may need a blood transfusion for platelets. If the conditions remains mild, the dengue can be managed at a home for body aches and fever. Use 1 or 2 tablets of Panadol and Tylenol every 6 hours. You can also use wet clothes and sponges to reduce a high fever. Make sure to get rest and drink fluids. Stay hydrated. Try to avoid using medicines like aspirin other than non-steroidal pain. They can also increase the risk of bleeding since dengue is caused by with virus. Antibiotics which fight against bacteria are not the treatment. If you have any danger signs of dengue fever, like severe pain in the abdomen, persistence, vomiting, confusion, drowsiness, fainting, cold skin, bleeding in the skin, nosebleeds, bleeding from the gums, and the dark stools, then seek medical care as soon as possible. Do not delay going to the hospital as the conditions may worsen quickly. Where does the mosquito live? How can we prevent and protect ourselves from dengue? The mosquito that causes dengue mostly rest indoor in dark places and in a cold shaded places. Outdoor, dengue mosquito breed and lay eggs in open storage water containers to prevent the mosquitoes from increasing in number, drain out the water from such containers. In case it is not possible to drain the water, then use insecticides to kill the larvae of the mosquito. Be careful about trash that can collect water, such as bottles containing plastics, bag stains, and tires. These special mosquitoes usually bite during the daytime and they are especially active about 2 hours after sunrise and before sunset. Wear full sleeveless clothes and long dresses to cover as much of your body as possible. Use mosquito repellents, mosquito coils, and electric vapor mats. If you are sleeping or sitting outside, use mosquito nets to stay safe nets. They are treated with insecticides are even more effective. These precautions can also prevent other diseases that spread by mosquito such as malaria. If we all work together, we can reduce the burden of dengue in your communities. Did you know the platelets? Platelets are the tiny cells in our blood that kill slow building. There is an injury every day. Our bone marrow makes 100 billion new platelets, that a million platelets every second. Platelets only live for 7 to 10 days. That means when you donate platelets, your donation must be transfused within 5 days. Also, when you donate platelets, your body immediately begins making new platelets faster and you are back to the previous level in 3 days. How amazing is that? Another reason to be grateful for a gifted body. Next, I am going to explain foods to eat and foods to avoid in dengue. Generally, any kind of fever, we should take food that easily digested and mainly takes in papaya. It is very helpful and increase the immunity and improve the platelets. Recent research tells that even goat milk also to increase our immune system. Green leafy vegetables, especially spinach, vegetables like beetroot and also very helpful to us. And dengue people suffer with dehydrations. To avoid this, people should drink excessive water, coconut water, fruit juices. Also, it will be very helpful. People should eat from which rich vitamin C like orange, pineapple, kiwi, etc. Protein rich fruits like pulses, eggs, meat are also very helpful. Eating leaves like neem leaves and basil leaves also helps to increase our immune system. Next we talk about food to avoid in dengue. Oil rich foods, junk foods and carbonated drinks like Sprite, Coca-Cola, in spices like pepper, onion, garlic. Why it is? It's damaged our intestinal tract. Hope this video is very helpful to you. If you like, please share and subscribe my channel. Thanks for your watching.